Hello, I'm Michael Nathanson from Yale University, and I'd like to say a few words about my study entitled Needle-Based Confocal Laser Endomicroscopy to Assess Liver Histology in Vivo. As you may know, there's been recent development of a confocal endomicroscopic probe that's thin enough to fit through the shaft of a needle. And there are some ongoing clinical studies now to assess the usefulness of this to interrogate the inside of pancreatic masses that are accessed by endoscopic ultrasound. We wondered whether we could similarly use this technology to examine the histology of livers in vivo, accessed either through endoscopic ultrasound or percutaneously. So we performed this study using the needle probe that's currently been used for patients with pancreatic masses, but we use this in an animal setting to look at rats with normal liver histology or with liver cirrhosis. And so we made a few very interesting observations. First, we found that the needle probe was indeed able to show us liver histology in vivo, and we were able to make a distinction between normal and cirrhotic histology. But even more interesting was we discovered that when we used the probe that had a 0-micron working distance and we applied it to the surface of the liver, then we detected a histological change in the cells that comprised the liver capsule that occurred in cirrhosis. And so this was another very important, I think, and novel observation that these cells that form the capsule of the liver can be used perhaps as a weather vane to determine what is going on inside the liver. And so we have ongoing animal studies to understand whether this will just help us distinguish between normal and cirrhotic livers, or whether these cells also will give us an idea of whether and to what degree there's fibrosis that may be before cirrhosis. In addition, a study that we're planning is to follow this up and examine patients who need liver biopsies, and we want to see if the EUS-guided needle-based confocal endomicroscopy approach can be used to determine liver histology. We think that it's particularly important that we can assess histology merely by placing the probe on the surface of the liver capsule, because much of the risk associated with liver biopsy occurs when one penetrates the capsule and puts the needle in the liver interior, and this has the potential to obviate that risk. This is the system that we use. This is the base system for the Cellvizio confocal endomicroscope. This is one of the needle-based probes that can fit through the shaft of a needle, and my collaborator, Al Manone, will demonstrate to you exactly how we carried out this study to interrogate the surface of the liver.
Okay, so I have an anesthetized rat here that I opened the abdominal cavity, and I'll start by injecting 0.25 cc's of 1% fluorescein into his vena cava. We'll give that a minute or so to circulate. So I'm just imaging along the surface of one of the liver lobes, not obtaining images.
Here we see confocal video images taken from the liver surface of this healthy rat. Notice the healthy sheets of hepatocytes and the absence of any fibrosis. By contrast, these are previously recorded video images from a cirrhotic rat. Notice the clear presence of fibrosis at the liver capsule.
I think that needle-based confocal microscopy is an important advance that will allow us to go beyond probe-based or endoscopic-based confocal endomicroscopy, because it now will allow us to access not just the luminal GI tract and the biliary tract, but also other sites within the peritoneum, pancreas, liver, and so forth, to obtain virtual histology during the course of an endoscopic exam. So I think it's particularly timely that we've seen in the past few years the development of notes, for example, because this could be the perfect partner to notes to enable us to obtain real-time histology at the same time that we're examining organs within the peritoneum.